Polycystic ovary disorder is a hormonal condition that ladies can get during their childbearing years. It can influence your capacity to have a baby. Your primary care physician will assess it as a fertility issue. It can likewise stop your periods or make them difficult to come, cause skin breakout and undesirable body and facial hair, raise your danger of other medical issues, including diabetes and hypertension. You can get medications for the indications. What is more, you might get pregnant, despite the fact that you may need to take meds to improve your fertility. A few women with PCOS have blisters on their ovaries. That is the reason it's designated polycystic. At the point when you have PCOS, your conception hormones are out of proper production. This can prompt issues with your ovaries, for example, not having your period on schedule or not getting it at all. Your body causes hormones to make various things to occur. Some influence your menstrual cycle and are attached to your capacity to have a child. Those hormones in PCOS are androgens, frequently called male hormones, yet women have them as well. Women with PCOS will in general have more elevated levels. Insulin. This hormone deals with your glucose. In the event that you have PCOS, your body probably won't respond to insulin in the manner in which it should. Progesterone. With PCOS, your body might have not enough of this hormone. You may miss your periods for quite a while or experience difficulty foreseeing when they will come. Some other hormones that can affect negatively for you to get pregnant are follicle stimulating hormone, luteinizing hormone, testosterone, estrogen. Symptoms of PCOS. The most widely recognized PCOS side effects are missed, irregular, inconsistent, or delayed periods. Abundant androgens can cause male pattern baldness, hair in places you don't need it, like all over, and skin breakout. Different side effects include obscured skin or abundant skin labels on the neck or on the armpits, mood swings, pain and pelvic, weight gain. In the event that you have things, for example, slick skin, missed periods, or hard to lose weight, you may think those issues are only an ordinary piece of your life. In any case, those disappointments could really be signs that you have polycystic ovary or ovarian disorder, otherwise called PCOS. The condition has numerous indications, and you might not have every one of them. It's truly basic for it to take a woman some time, even years, to discover they have this condition. You may be generally pestered by a portion of the PCOS side effects that others can take note. These include hair development in undesirable areas. Your primary care physician may call this hirsutism. You may have undesirable hair developing in spots, for example, aura or jawline, bosom, stomach, or thumbs and toes. Balding. Women with PCOS may see diminishing hair on their head, which could exaggerate in middle of age. Weight issues. Some women with PCOS battle with weight gain, skin inflammation, or slick skin. In light of hormone change identified with PCOS, you may create pimples and slick skin. Issues, dosing, feeling tired constantly. Cerebral pains. This is a result of hormone change with PCOS. Hard to get pregnant. PCOS is one of the main sources of infertility. Period issues. You could have unpredictable periods, or then again, you probably won't have a period for a while. Or on the other hand, you may have overwhelming sleeping during your period. On the off chance that you have a few of these side effects, let your primary care physician know. There are medications or things you might have the option to do to facilitate these issues and see whether you have PCOS. The sooner you begin, the sooner you can begin feeling much improved. Causes of PCOS. Specialists don't have the idea about the reasons why some women get PCOS. You may be bound to have PCOS if your sister or mom additionally has it. It could likewise be identified with issues that make your body produce an excessive amount of insulin. which can influence your ovaries and their capacity to ovulate or discharge eggs. Pcos diagnosis. No single test can analyze Pcos. Your primary care physician will begin by getting some information about your side effects and clinical history, and by doing a physical test and conceivable a pelvic test. They may give you a blood test to gauge your hormone levels, glucose, and cholesterol. An ultrasound can check your ovaries for growth, search for tumor, and measure the covering of your uterus. You have to address inquiries concerning your family's clinical history, including whether any woman in your family has PCOS or issues getting pregnant. This data is useful. PCOS will in general run in families. Be prepared to examine any period issues you have had, weight change, and different concerns. Your doctor may diagnose PCOS if you have at least two of these symptoms: irregular periods, high levels of androgen, male hormone, shown in blood tests or through symptoms like acne, male pattern balding, or extra hair growth on your face, chin, or body, cysts in your ovaries as shown in an ultrasound exam. PCOS treatment. Physical exam. Your doctor may check your blood pressure, body mass index, and waist size. She may also look at your skin to check for extra hair growth, acne, and discolored skin, which can all happen if you have PCOS. Pelvic exam. This is just like what happens when you get a regular checkup. The doctor will look at and feel areas of your body, including the vagina, cervix, uterus, fallopian tubes, ovaries, and rectum, checking for anything unusual. Pelvic ultrasound sonogram. This produces an image of what your ovaries look like. With the ultrasound, you lie down and the doctor briefly places an ultrasound device in your vagina. The doctor will check for cysts in your ovaries and how thick the lining is in your uterus. That lining may be thicker than normal if your periods aren't happening when they are supposed to. Blood tests. Your doctor or other healthcare provider will take a small amount of blood from a vein in your arm. Lab tests will measure the levels of these hormones. Chorionic gonadotropin. This is a hormone test that can check to see if you're pregnant. Anti-Mullerian hormone. This test can check how well your ovaries are working and to help estimate how far off menopause you may be. The levels would be higher with PCOS. The doctor will work with you to manage your PCOS symptoms and become as healthy as you can be. Treatment will rely upon your symptoms, your age, and whether you need to get pregnant. In case you are overweight, losing a little, even 5% to 10% of your weight, can cause you to feel better. It additionally may help the manner in which your medications work and improve your fertility. Your primary care physician may guide you to take the diabetes Medicaid metformin to bring down insulin opposition, control ovulation, and help with weight reduction. In the event that you don't want to get pregnant, your primary care physician may endorse hormonal anticonception medication similar to the skin fix or the pill. These meds can help bring down your danger of endometrial malignant growth, get your periods on track, clear up skin inflammation, and diminish additional body hair. If you would like to get pregnant, infertility meds can enable your ovaries to discharge eggs. Get some information about drugs to treat body hair and skin breakout, and stay healthy.